Hello and welcome to Call Doctor podcast. Today we have Dr. Satyaki Arora, an expert in pediatric dentistry and specializing in orthodontics, sleep apnea and care for children with anxiety and special needs. Taking a child to a dentist is very difficult, doctor. We all know about it. When is the first time a child should visit a dentist?
Ma'am, see, as per the literature, the child's first dental visit should be at the age 1 or within 6 months after the eruption of first incisor or first tooth, milk tooth. But what I recommend is whenever any female is pregnant, they should visit the dental clinic so that we can teach them. There are certain things that we have to take care beforehand.
Okay.
That like gum inflammation. Normally, mother should get the cleaning done so that their gums are healthy. Second, they should check about different vitamin levels, mainly vitamin D, because these days we are seeing a lot of kids with molar incisor hypoplasia. That means the new permanent molars which are coming out, they are not mineralized properly. So for this also, second, there is a very important problem that happens because of sharing of utensils from mother to child. Because at the time of pregnancy and after the pregnancy, when you have a newborn, mother have a tendency to share the utensils. Mm-hmm. So because of that, the first transmission of bacteria which can create cavities transfer from mother to the kid.
Okay.
So that it is very important not to share the utensils. Now, coming back to the question, when is the right time to see a kid is first year or within 6 months after the eruption of first milk tooth.
Right.
So that we can teach them how to brush, how to take care of the teeth. Second, there are certain problems that we can see before, like tongue tie. If there is any tongue tie, because there will be difficulty in breastfeeding, there will be difficulty in the jaw development as well as speech. That also can be corrected early.
Coming to brushing the teeth.
Yes.
It's very hard for us also, even for my children, to brush the teeth because first of all, they might be cranky, they wouldn't like to brush. Second thing, to convince them and brush properly because they don't show the teeth properly. Would you like to give us few tips which will be easy and fun basically for kids and parents?
See, what I always tell patients and parents, that let your kid decide and choose toothbrush and toothpaste in the supermarket. Let them decide which flavor they want, which toothbrush they want, if they like the appearance. Because if they have chosen the toothbrush and toothpaste, they more likely they will accept toothbrushing. Okay, this is one thing. Second thing is, whenever you have to make, I always say, always brush together in the night. Because nighttime brushing is more important than daytime. It is not like daytime brushing is not important. Because nighttime when you sleep, there is no saliva. So when there is no saliva, we don't swallow. So if suppose you have eaten something, it is there on your teeth for longer duration. So you have to brush in the night. And kids will be more cranky in the night because nobody wants to brush in the night. You want to sleep. So if as a family you will brush together, it will become a fun activity. And then you can brush properly.
Doctor, why do baby teeth matter so much if they are going to fall out?
Ma'am, see, first of all, baby teeth are going to fall after a certain age. Mm-hmm. There will be a time when baby teeth are only there to eat food and mastication, so that you can eat and chew food properly. Second, and the most important part of the baby teeth is to guide the eruption of permanent teeth properly. There are so many cases where baby teeth are removed prematurely. That means it is removed before age, when is not the right time. Then what happens is the permanent moves into the space of the baby tooth and the new teeth becomes irregular, it becomes crowded. Sometimes even the permanent teeth gets impacted inside. So it is very important for baby teeth to be healthy and to stay there for the proper time.
Doctor, tell me something. What is the most common mistake that parents do when trying to prevent cavities?
See, the problem with parents are they love their kids a lot. Now, the first priority for the parents is food. Whether my kid is having food properly or not. Now, during the early age, what their main focus is whether my kid is drinking enough milk or not. Because that is the main source of nutrition. Now, in that way, they are giving milk in the night. That is called as baby bottle feeding. This is the main problem. Now, if suppose we tell them that, after age 1, weaning should start. Ideally, after 6 months, weaning should start. That means we should stop bottle feeding and we should you can use sissy cup or we can use normal cup for the milk. Now what happens is they give milk, and when we tell them not to give milk in the night, they feel like the nourishment or the nutrition will not be proper for the kid, and they keep doing it. In that case, there is pooling of milk around the teeth, and the kids develop bad cavities. So from the parents' point of view, they are doing good because they are giving nourishment and nutrition to the kid, but in the process they are damaging all the teeth. So this is the main problem right now that we face.
Okay. Doctor, there is a lot of debates about fluorides, toothpaste, which toothpaste to use, what kind of toothpaste to use. Can you suggest us which is the best toothpaste to use which is safe for kids basically?
Ma'am, see, so normally when we speak about fluoride has two main parts. One is topical, one is systemic. Topical application of fluoride when we are applying anything topically onto the teeth for the localized effect. Systemic absorption of fluoride when we are giving it systemically. You must have heard before we used to give fluoridated water and fluoridated chewing tablets so that we can increase the fluoride intake. There are a lot of controversies regarding systemic absorption of fluoride. So normally why we recommend kids toothpaste to kids, because it contains less ppm of fluoride. Adult toothpaste contains more ppm of fluoride, approximately 1450 or 1500 ppm of fluoride. Why there is a difference? The difference is in kids toothpaste fluoride is less because kids normally they swallow the toothpaste. When you are swallowing the toothpaste, you are swallowing the fluoride. That means that it is going into the systemic absorption. We do not want that. That is why we try to give toothpaste which contains less fluoride, which is approximately 500 or less than 500 ppm of fluoride for kids. As per what I have understood is once kids they start spitting the toothpaste out, you can use the adult toothpaste which has more fluoride, because fluoride has a good role to play in prevention of cavities when applied topically. So it is fine to use adult toothpaste once they start spitting the toothpaste out.
Right. Doctor, how does sugar really affect a child's teeth?
Ma'am, see, when we speak about sugar in a very broad way, every food, most of the food that we eat has carbohydrate in it. So in one or the other way, any food can cause cavities. Bacteria, they ferment on sugar and then they release acid. We say that whenever you eat anything which has sugar in it, it creates acid for 20 minutes. So one important thing is quantity that we eat, and the main important thing is frequency, that how frequently you consume sugar. Because if you are consuming sugar frequently, that means you are creating acid again and again in your mouth. So when we say, if suppose you are eating one chocolate in 10 times the same chocolate in 10 different small portions in the entire day, then it is more harmful than eating it together. This is one thing. This is how sugar creates cavities, and this is how we can prevent it by reducing the frequency. Normally what I recommend is, if you want to have, because every food normally, there are so many things which are available in the market, everything has sugar in it, and we cannot completely stop sugar intake now in kids because of different options. So what I recommend, whenever you're giving food, taking complete meal, that time have sugary food also with it if you want to have. But in between, like normally snacking is not good in between meals that we eat food. But whenever you do snacking, it should be healthy. It can be dates, it can be natural fruits, no juices. So anything which is healthy you should give during snacks if you are giving snacks. But that time you should not include anything which is sugary. Now sugary food includes everything like chips, biscuits, sugars, chocolates, candies. Main important, one of the things which parents they give and they neglect is gummies, which has vitamins in it. They feel they are good for health, but they are very damaging for teeth.
Doctor, coming about snacks, kids love to snack and they want for sure, they want. Just to give us small informations about it, what is the best kind of snacks which kids can have?
Ma'am, vegetables, green vegetables are the best food that you can have during snacks. You can have fresh fruits, you can have dry fruits. These are the things which are good for snacking. Nothing which has preservative in it, nothing which is sugary, that should not be given.
Doctor, there is a lot of confusion sometimes, like even I myself think that how often should I brush? Twice or thrice, or maybe even after every meal? Could you please tell us what is the best way of doing it?
So normally minimum we should brush 2 times every day, morning and night. Okay. When you are brushing in the night, then in the morning you have to just rinse your teeth with water, because then you have good bacteria for digestion. You have so then after your breakfast you should brush. This is ideal way of brushing. But if you want to see what is best, there is a rule which is called as 3 into 3 into 3. What is 3 into 3 into 3 rule? You should brush 3 times every day, 3 to 5 minutes after finishing your food, for 3 minutes. So if you are doing this, chances of cavity formation will be very less. This we can follow. There is one more literature which says that we should not brush immediately after finishing our food, mainly because we have good bacteria that time, maybe because we have a lot of acid formation because we have just eaten food. We should wait at least 20 minutes and then do the brushing. But whichever way we do, morning brush should be after breakfast. It should not be before breakfast. And then night time, once you do brushing, you should not eat anything after that.
Doctor, what should a parent do when a child has a dental emergency? Maybe the teeth is chipped off or knocked out.
So, ma'am, there are two different aspects. One is when the tooth is chipped, when the tooth is knocked out. First, let's speak about when the tooth is knocked out. This is called as avulsion, when the whole tooth has come out. Now, if it is a baby tooth, which has come out from the socket, then no need. We don't re-implant the baby tooth back into the socket. Maybe because we do not want ankylosis to happen. We do not want it get fused with the bone, and splinting we don't do for the baby teeth. But when it is a permanent tooth, then timing becomes very important. We say that the natural implantation, if it can happen within 5 minutes of the avulsion, the prognosis is going to be very good. That means if it is possible for the parent, they should hold the tooth from the crown area. They should just wash the root with the running water, and they should try to put the tooth back into the socket if they can. And then they should visit the dental clinic immediately. Even the position, if it is little different, then it is fine, because the dentist can reposition it, and then we will splint it and it will heal. But because it will go back into the socket, there will be no damage to the cells and the healing will be good. But most of the time parents, they are scared doing that. So then what they can use is, they can use a skimmed milk, which is no fat milk, dip that tooth into the milk and rush to the dental clinic. Because if the reimplantation again done within 60 minutes, then also prognosis is fine, but it should not be delayed more than 1 hour. So timing is very important in avulsion cases. Now second is a chipped tooth, when the tooth is chipped. Now if the tooth is chipped, then it is not an emergency as such. But normally when the tooth is chipped, maybe there is some laceration, maybe some subluxation, that the tooth has moved into the socket. So in any case of a dental trauma, better to visit dental clinic as soon as possible.
Doctor, is there any signs of dental problem which parents usually miss?
Ma'am, we have a technique we always teach parents, which is called as lift the lip technique. Now what is lift the lip technique? Initially in smaller kids, cavity formation starts at the front teeth at the gum line, because normally we don't lift the lip, we don't see the cavity formation or the brown line at the gum line, and we miss it, and suddenly they see that the tooth is broken. So I always recommend parents to do lift the lip and see if there is any brown line or white line forming at the gum line. If it is forming, it is the initial start of a cavity and they should get the treatment done.
Okay. Coming into a funny question, if the tooth fairy could give the children's one dental tip, what do you think it could be?
See, so tooth fairy can give only one tip, that the parents are the tooth fairy and kids should respect them.
Amazing. That's the best tip. What is the best thing you feel being a doctor?
See, I'm a pediatric dentist. So for me, and I have chosen pediatric dentistry as a branch because it is very emotional and affectionate environment you create when you give good smile to a kid, or when the kid comes in pain and goes smiling. So that is the best feeling you can have in a day. Even though if kids sometimes they are difficult, but still when you manage them, it gives a lot of pleasure.